Before we begin, please know that some episodes include language that may be sensitive for some people.
Welcome to another episode of The Birth Portal. My name is Connie. Today's true story began in the early morning with this woman I'll call Samantha having irregular contractions, a stage of labor called the latent phase, a term some people call false labor. But by about 8 a.m. or so, she paged her midwife to come to assess her at home. When her midwife arrived and checked her cervix, Samantha was about 6 centimeters dilated and fully effaced. The cervix is at the bottom of the uterus and can be about 3 or more centimeters thick and is closed during the pregnancy. The tissue of the cervix is firm, kind of feels like the tip of your nose. The body releases hormones that start to soften the tissue to be able to thin it out. This thinning is called effacing. Fully effaced is when the cervix is as thin as a piece of paper. The cervix is also opening as it thins, and we say a cervix is fully dilated when the opening is about 10 centimeters and you can't feel the cervix anymore as the baby's head has passed through and is moving down into the vagina. Samantha's midwife felt that she was progressing quickly, and as this was a planned home birth, she paged me to come as the backup midwife. However, Samantha wasn't progressing quickly, so we passed the time walking around the block with Samantha, stopping, leaning forward every 5 minutes or so for a contraction, and after about an hour, we went back to her home. Samantha announces she now needs to do her belly casting. In my head, I'm thinking, not the time for belly casting. I'm imagining her suddenly fully dilated with wet plaster on her breasts and belly. How's that going to unfold? But Samantha insists she's going to do this. So there she is standing in the tub, plastering her belly, and I'm ready with the blow dryer, ready to expedite the drying process. Thankfully, we were able to dry it enough to take it off, as things started to pick up in terms of her contractions. Finally, Samantha was fully dilated, and she wanted to lie on her bed to have the baby. Her husband was at her side. As the contractions would come, her midwife would quietly say, "Let the sound out, Samantha. Let your body go limp." She responded so well, and this tiny little baby was born. He was limp and not wanting to breathe. I dried him off with a towel, and that didn't seem to work. The midwife asked me to bring the Laridol to her on the bed and kept him attached to the cord. After a couple of puffs, he started to breathe on his own. A Laridol is a piece of equipment all the midwives in Ontario carry with them. It is similar to the bag and masks used on adults who need sudden CPR, or cardiopulmonary resuscitation. In fact, midwives in Ontario carry all the same equipment and medications to manage births that a level 1 hospital would have, with the exception of vacuums, forceps, and the equipment to do a cesarean section. Vacuums are like a small cap, smaller than the palm of your hand, and that cap is carefully placed on the occiput of the baby's head. An occiput is the back of the baby's head close to the top. A suction is created through the cap, and the handle is pulled by the doctor while the mother pushes. Forceps are metal-like oval-shaped handles that connect together and are carefully placed ideally on the sides of the baby's head. And with a contraction and the mother pushing, the doctor pulls on the forceps to assist bringing the baby low enough to deliver the baby vaginally. Sometimes these are not effective tools, and then a cesarean section is required. As I said, this was a tiny baby, less than 6 pounds. Although it was a term baby, which means more than 37 weeks gestational age, in the community I was working in, the baby should have been transferred to the hospital for monitoring. As well, because the baby needed help breathing, that too is another reason to transfer to the hospital for monitoring. The midwife negotiated with the client to ensure that the baby was fed every 2 hours until she returned the following day, and to page with any concerns which were carefully reviewed. Thankfully, the baby did well with no further concerns. I never did see the finished belly casting, but there are some really artistic castings that I have seen before. Thank you for joining me for another episode of The Birth Portal.